Modern life is full of stress and worries. The competitive world has given us a challenging life, and many a times we cannot cope up with a fast-paced life, which leads to physical, mental and emotional disorders, which shatter us completely. In the modern world, mental health disorders have become a leading cause of disability globally, exacerbating human health. With the divine blessings of Lord Dhanvantriji, hope lies in Ayurveda. Dr. Navdeep Sharma, a spiritual healer from the city of the Golden Temple. His graduation from Sri Lakshmi Narayan Ayurvedic College, one of the oldest institute in our country, associate with Sri Durgyana Education Foundation. His masters from the University of Madras. His PhD in the role of Ayurvedic herbs in psychological disorders. Listed in the World Book of Records for promoting Ayurveda and developing a chain of Ayurvedic treatment and Panch Karma centers in various parts of the globe.
डॉक्टर नवदीप शर्मा को दुनिया भर में आयुर्वेद का जागरूकता फैलाने के लिए सम्मानित किया गया लंदन में.
A very good day to all of you in this live interactive session of ours where we always try to discuss quality Ayurveda with you while taking the maximum of your questions. And today's live is a bit special. It is a live which I am doing currently for you from Gatwick. And once again, the most important thing, how can we feel that whether a child is really an autistic child or not? And the more I come in interaction with children around the globe, the more I realize that many of those innocent souls have been tagged with autism and they are labeled as being autistic, and unnecessarily they are sent to so many therapy centers. And when we send them to therapy centers, what we actually need is not what is being actually done. Welcome Deepa ji. You have mentioned that, hi sir, ਮੇਰੇ son ਦਾ ਨਾਮ ਸਹਿਜ ਹੈ, ਅਸੀਂ ਤੁਹਾਨੂੰ ਲੰਡਨ ਮਿਲੇ ਸੀ ਫਰਾਈਡੇ ਕੋ ਔਰ ਬਾਰ-ਬਾਰ ਟਾਇਲਟ ਜਾਣਾ ਸੀ, ਤੁਸੀਂ ਕਿਹਾ ਸੀ ਕਿ ਉਸ ਮਿਲਕ ਫਾੜ ਕੇ ਦੇਣਾ, ਅਸੀਂ ਪੁੱਛਣਾ ਸੀ ਕਿ ਕਿੰਨੇ ਡੇਜ਼ ਦੇਣਾ ਹੈ ਸਰ? ਹਫਤੇ 'ਚ 3 ਵਾਰੀ ਦਿਓ ਜੀ ਤੁਸੀਂ ਦੁੱਧ, ਇਸ ਤਰ੍ਹਾਂ ਦਾ ਫਾੜ ਕੇ, ਉਹਦਾ ਬਹੁਤ ਫਾਇਦਾ ਹੈ ਬੇਟੇ ਦੇ ਵਾਸਤੇ, ਉਹਦੇ ਨਾਲ ਗ੍ਰੈਜੂਅਲੀ ਜਿਹੜਾ ਉਹ ਬਾਰ-ਬਾਰ ਮੋਸ਼ਨ ਜਾਂਦਾ ਉਹ ਠੀਕ ਹੋ ਜਾਏਗਾ. ਮਤਲਬ you can give that milk in alternate days to your child. Manish Takriya ji, a very warm welcome to you. And as always, your questions will be priority for me. Wherever I feel that yes, there are questions from your end, I definitely will be prioritizing those questions. But then a very important thing which I was discussing with you, that in many cases, a child is labeled as being autistic child, but is the child actually autistic? Many a times the parents, they put in a lot of energy of theirs in this particular thing, that they try to decide, they try to figure out, they try to find out, they go to psychologists, they get again and then again an evaluation for the child. It is very much understandable that no child should be tagged autistic. No parents love that a child is tagged autistic. And that's why when children, they come to me, until and unless a child is strongly autistic, I always advise the parents that, see, the best thing is, let us work in the right direction. Let us figure out what are the strengths of the child. Let us figure out what are the weaknesses of the child. And once we can figure out the strengths, the weaknesses, we definitely can work together in bringing the child out of autism. Now, something which is really very important for us to understand over here is that many a times when a child is not speaking, or when a child is not responding, or when a child is not behaving in the way in which we want the child to behave, the parents, what they start doing is, they work very hard on the children, but what they start doing is, they start guiding their children, they start ordering their children, they start instructing their children, they start commanding their children. For example, hey John, come over here. Hey John, say good morning. Hey John, say hello. Hey John, sit over here. Now all these are commands, and commands, the more we use those commands, the worst it will become for the child. Because honestly speaking, commands are not something which are going to bring your child out of autism. If you really want a child to come out of autism, the entire learning should have not more than 10 to 15% commands for your child. And that is why I am not a big fan of occupational therapy. That is where I dislike the concept of going for occupational therapy for years and years together. Occupational therapies, with due respect to what occupational therapy does for a child, but it has a limited scope for autistic child. So in the beginning, when we really want a child to have a better eye contact, when we want a child to have a name response, yes, there definitely the occupational therapy can help the child. But if we feel that that occupational therapy can enable a child to come out of autism, now that's really not going to happen. If we really want a child to be out of autism, we as an entire family, as an entire unit, has to combine, and then it is the family. It is the family under the guidance of someone who is pretty trained in how to go about the child. Like in the ancient time, the grannies knew that is how we need to go about the child. And if someone like that joins, then really we can bring a child out of autism. So over here, I am having your question, and the question which I have over here is that 1.8 month baby not speaking. Maniji, it is your question. So you have mentioned that Baba, Mama, the child is using that. So it becomes very important over here for us to understand that the screen time for the child should be pretty less. And again, are we creating sufficient situations where the child knows that I am to speak Baba, where I know I am to speak Mama? What entirely and exactly we are trying to do if we want him to speak Baba and Mama. So see, if nothing goes wrong, a child will automatically see how his parents are conversing, in which language the parents are conversing, and the child will start conversing in that language. But that's not always the case. Unluckily, many children will not start using those words. But there is nothing wrong about it. They can start using words after some time, but the problem lies in the fact is that nowadays we try to pamper our kids so much that without them speaking something out, the thing is ready for them. And again, due to the busy curriculum, both parents working and the families not having a very strong support system, the child is left to either the TV or the mobile, or the child is left to a daycare center or to a special school. Now, are those really going to bring the child out of autism? The answer is no. They can give a bit of support. They can help you fetch some time for your own self, but they cannot help your child come out of autism. When I say a child can come out of autism, many are of different opinion. Many a times when the parents they meet me, a major chunk of my time goes in convincing them, in guiding them, in proving them that yes, a child can come out of autism. When I say autism is a temporary phase in the life of a child, if treated timely, that is not always well taken by all parents. At times when the parents they approach me, I can see it in their eyes that they are feeling that something is fishy about me speaking this thing. And many a times I can feel that they are not pretty convinced. And one of the major reasons for that is that they have Googled it ample times. They have met various psychotherapists. They have met their GP. They have met various consultants. And when everyone is saying that, see, things are not going to change, the child is going to remain like this throughout the life. And all of a sudden they see someone like me who is saying it becomes tough for them to believe, and that is understandable. But then I always tell the parents that go through as many case studies as you want to. When I say case studies, we mean case studies. It's not testimonies. Testimonies and case studies are entirely different from each other. When we make case studies, we share it with parents through our YouTube channels. We share it with parents on when they meet us at various places around the globe. The reason why we share those case studies is that we really want the parents to understand how a particular child came out of it. How was the journey? What did the parents do in that child? What were the problems of the child when he started with us? Was he having less eye contact? Was he less responsive to his name? Was he also non-verbal? Was he using sign language and gesture language? Was he hyperactive? Was he aggressive? So when the child was just like your child, and the parents, they believed us. They worked with us in tandem as a team. And when we together were able to bring their child out of this autistic phase, the same is pretty much possible for your child also. And that is the answer to your question, Manishji. Mild autism. When we talk about mild autism and even moderate autism, if the parents believe us, if they take the right steps at the right time, yes, definitely, a child will always come out of mild autism. The only thing, the MRI should be normal. The child should not be having any chromosomal aberration. When I say that, there are some cases, very few of them, where there will be some genetic issues with the child, where there will be some kind of delayed growing in the child, which has caused some brain damage for the child, and there are some underlying reasons. So leave aside those 5% cases and 95% of rest of the cases where this is not the case. If you are working in tandem with us, when I say in tandem with us, I mean to say certain herbs in Ayurveda and then certain techniques on the psychotherapeutic front. When I say certain herbs in Ayurveda, always be careful when you are to use Ayurvedic herbs. Every child is different. The herbs which are good for one child may not be good for the other child. So a doctor needs to diagnose, a doctor needs to decide whether I am to work on hyperactivity, whether I am to work on self laughter, whether I am to work on speech, what exactly I need to work on, and accordingly the herbs they need to be decided. Just today, just today, I went through a case where the parents were well educated parents and they were giving saffron to their child under the guidance of someone. They saw it on YouTube and they started giving saffron to their child. Another one was giving, 2 days back, I met someone and the parents, again well educated parents, they were giving Jyotishmati to their child. Is Jyotishmati going to bring the child? The child was so hyperactive, and Jyotishmati itself causes so much of hyperactivity. So we need to be careful. We need to understand what exactly we need to be giving to the child. So, Reshamji, when you say that your child does not speak, he only repeats. The good thing about here is that at least he is repeating. He is better than those parents where the parents they come to us and the child is not having any kind of words. When we say any kind of words, that is very important. Where the child is only using gesture language or is blabbering like ba, ba, or even completely non understandable blabbering. Over there also, if we are walking in the right way, in the right direction, that blabbering will change to words. These words will change to in context word. Those in context words will then combine together to make two words. So it has to be in phases, it has to be in a very positive and a planned manner. Yes, when we talk about a child from BEG Fund, you have seen what is autism spectrum level 2. I mean, how kids are diagnosed based on such levels. Honestly speaking, when we talk about various kind of psychological assessments, now when we talk about any psychological evaluation, with a due respect to all those psychological assessments, the most important thing for us to understand is that they will ask the kid to perform certain things. Now, a kid may be in a positive frame of mind on that particular day, or he or she may not be in a positive frame of mind on that particular day. Again, if a child is not willing to perform on that particular day, he will fall on a higher spectrum than the normal spectrum, like milder one. What is important for us as parents is to know is that we should always test our child for these few parameters. Number one, is the child hyperactive? If the child is hyperactive, and if you are to give 10 marks out of 10, what is the score of your child in hyperactivity? Check it, feel it, attach a video of your child to us and share it to us with your observation. The second, the speech. Is your child completely non-verbal and there is no blabbering also? Or is your child a bit verbal but not in context? For example, he says pa pa pa, ma ma ma, but not when he sees you or when he sees his mother. So it is not in context, but yeah, he is blabbering. There is a third one who will do blabbering, and the blabbering will be in context. Like when he sees you, he'll say pa pa pa, but not complete pa pa, and not all the time. So again, there are various levels to which a speech can and could have developed. So you need to share a video of your child at his best speech when he's using certain things, or you need to mention it the child is completely non-verbal. Now comes the third thing, that is the eye contact. Generally, when we talk about autistic child, the child will not make eye contact when the child is corresponding with you, when the child is speaking with you. So the most important thing over here is that we need to understand that all the herbs which we are using over here, this is specifically is for you, Triloknath ji. I can very well understand that you need to reduce the hyperactivity of your child. But the most important thing for us to realize over here is ABA, the activities, understanding the behavior of your child, and then following the guidance given by our AB expert. Many a times when I say that, the parents they tend to tell me that see, our child is already going on for the AB expert issued by the NHS or the AB expert issued over there in US, in Canada, in all those countries. With due respect to all that the AB experts are doing over there, what we need to realize over here is that we are using certain herbs for your child, and that herbs are going to bring your child to a particular positivity level. And when we say that, it becomes very important that someone who knows how to work in tandem with our herbs is taking care of the AB of your child. The child should not be commanded. When we are using our herbs, commands, if you use commands, the potency of the herbs, the efficacy of the herbs will come down. And if you start using tacts, using techniques in the way in which our experts are guiding, the hyperactivity will start coming down. So I would appreciate if you can mention it for me. Who is doing the ABA stuff for you? How many therapies have been done till now? What is the frequency of those therapies? That means how many therapies you are going for every week for your child. And that is very important that we do the ABA for him persistently. And I would also like to know the age of your child currently. It's very important because age is something. And I would appreciate if you can share the patient code of your child so that my team can then provide me with certain details. And under any circumstance, when we are going live, don't miss out on those lives. There are so many lives which we have on this channel of ours where we work in tandem for those who are highly hyperactive, where the hyperactivity is not reducing. There are various techniques which we follow, but we need to go to the depth of it. What is causing that hyperactivity in him? What is the cause of the distress? How is the home environment? And when I talk about home environment, that is something which is very, very, very important for us to realize. If I want a child to be non hyperactive, a child to be non aggressive, I need to set an example for the child. It becomes very important that the environment at home is such that the child is not getting an example of aggression set up over there. No quarrels of parents. The child should see utmost peace in his parents and in the environment around him if we want a quick improvement in the hyperactivity. So, figure out all the reasons, and I would appreciate if you can share some further details into this regards. And Reshamji will like to have some videos of your child, and then the team can guide you. As I just mentioned, each child is different, and it becomes very important that every child is analyzed. And when the child is analyzed, once the child is analyzed, we see the reason what will make a child to speak. The herbs which we are using bring a child to a situation where all the words in his subconscious mind come to the level of conscious mind, so that if a situation is created in the way of ABA, the child will definitely use words. But then that needs to work in tandem with each other. And moving further ahead, before I go to the next question, Trilokji, I would also appreciate if you can share the dosage of Brainova DS that you are giving to the child. So there are multiple things which I would like to know from this case, because if we are giving treatment to any child, any one of you is there with us, and if everything is followed within 6 months, the hyperactivity goes down markedly. So if it is not going down markedly, we need to figure out why. What is the reason for that? The next question, which I can see over here for Ryan, Gia is the concerned person, and Gia ji, you have asked a question. Autism क्या बचपन से होता है या बाद में डेवलप होता है? अगर बाय बर्थ होता है तो उसके इनिशियल सिम्टम्स क्या होते हैं और कैसे पहचान कर सकते हैं? अगर एक बच्चे को ऑटिज्म है तो दूसरे बेबी को होने के चांसेस कितने हैं? और अगर बाय बर्थ है तो सिम्टम्स के बारे में इससे कैसे जल्दी कंट्रोल किया जा सकता है? The most important thing for us, Gia ji over here, I'll be choosing my language of reply today, English, because this is an international live and majority of our patients won't be able to understand Hindi. So I'll be answering to your question. When we talk about a child having autism since the birth, now there are very less children who are autistic since birth. In majority of the kids, a regression will occur. The child will be using certain uh, words, the child will be using certain things, but the most important thing over here for us to understand is that despite all that stuff, due to some odd reason, maybe increased screen time, maybe a change of living place, shifting of house, shifting of country, or something which really sent a shock for the child will stop using words. Child will stop interacting, stop making eye contact. So there are multiple cases, majority rather, I would say, where regression occurs. So if your child is not making an eye contact with you, which a child should start making at a pretty early age. If your child is, say, 6 months and old, and he still is not making eye contact with you, is not giving a smile to you, and he's not recognizing you as parents. Now, those are some of the things which give you an indication at a pretty early age that yes, something is wrong with my child. So, again, when I say something is wrong with my child, it may be that you're not giving ample time. It's not necessary that he has come into this world with autism. No, there are very rare ones who come in this world with autism. Majority ones are the ones who are made autistic later on, but by what we are doing. So, coming to the next question, and when we talk about how to control it quickly, the most important thing is understanding and analyzing the behavior of your child. And once we understand the behavior of the child, once we analyze it, then changing our behavior according to the child. We need to understand that, see, the child is not going to change as far as our behavior is concerned. It is we, as parents, who need to modify our behavior. And we need to modify that behavior for the betterment of our child. So, the moment you feel that your child is different, don't wait for someone to tag your child. Many of the parents, they waste so much of their valuable time in waiting for NHS or their GP or a psychological assessment after that, so that the child is tagged as being autistic and everywhere around the globe. Why do we need a child to be tagged? If we know our child is different, it becomes very important that we should make him normal. Why wait for a child to be called autism before you reaches out for any kind of help or any kind of support? It should be done immediately when you feel that yes, the child is different. So for BEG Fund, we are in a very early stage of my son's treatment with you and your time. I really want to mention that it is doing miracles daily for him, but we know journey is still long. I know we will win. Yeah, we surely will win as a team. Be rest assured. And the best part of it is, wherever the parents they believe on us and wherever they follow what is being guided during those ABA sessions to them, and wherever they give some time for the children, believe me, the child will always come out of it. Because no child, when God has given this human birth to a child, no child wants to be isolated. It is a basic human instinct that whatever might be the current condition of the child today, which is not socializing today, which is not talking, innately the child wants to talk. The child wants to correspond. The child wants to be social. The child wants to play. The child wants that I should do everything which any other child is doing. So, yes, wherever the parents are pretty helpful for the child will always come out of it. So, yes, that's very good that you are working with us as a team. We will never let you down. Carry on with the good work. So, in case of Divyam has sensory issues around his mouth, and in case I get some details further from my team in regards of Divyam, I will further be elaborating on that question. And because I need to have some details of Divyam, if you can help me out in that case. And yeah, Divyam, about Divyam, we have recently started the treatment. And as far as the sensory issues of his mouth are concerned, the Braino R and then the Braino R Mile, whichever variety we have started for Divyam, they always work on the sensory issues of a child. But while they are working on the sensory issues of a child, we need to give the child an alternative to share the emotions. And that is again where the ABA creeps in. That is why we generally tackle all these things with ABA rather than giving anything which is sedating to the child in all such cases. So give us some time. It's really good that you have started the treatment of your child with Divyam with us. And be rest assured, sensory issues, especially mouthing, generally takes 3 months to 4 months to start fading away. So it will soon go away, but we need to be a bit patient. Don't worry about that. Just to remember, it is taken well care of. So going further, King's Kingdom. Hi, Dr. Sharma. Are there any deficiencies in food during pregnancy that cause autism, or it's genetic or any kind of stress development develops autism in child before birth? So in those cases where a child is autistic because of certain conditions during the pregnancy, everything which you have mentioned is worthy of causing autism. Again, if there is severe iron deficiency in a female at the time of pregnancy, or there is severe hypothyroidism, those also cause intellectual disabilities. But what I really want the parent to understand over here is that intellectual disability is a different thing and autism is a different thing. A child with intellectual disability may or may not have autism, and a child with autism, in most of the cases, will not be having intellectual disabilities. So, most of these things, if they cause autism, that will be an autism associated with some kind of intellectual disability. Then that can be caused by genes also. There can be Fragile X syndrome, there can be Down syndrome, there can be various syndromes. Yeah, there are genetics associated with the pre-pregnancy time, at the time of zygote formation, and during the pregnancy time. So these things that can cause autism. But the most important thing for us to understand is that in 95% of the cases who come to me for treatment, I see other reasons. The reasons are after the delivery. They are not prior to the delivery. And then at the time of delivery, a child may have a delayed crying due to less oxygen supply. When a child will cry delayed, the child will not get the necessary oxygenation for the brain, which is required immediately after the delivery. Because when we talk about our brain, the brain is the most active organ of our human system. So it requires the maximum flow of blood for it. So whenever that blood flow, the oxygenation, it reduces even for a few seconds, that causes damage in certain areas of the brain, which can be checked through a PET scan, a PET scan, or which can be checked through a contrast MRI. That is why, for those who meet me and they have not gone for MRI or a PET scan, where I feel there are intellectual disabilities, where I don't feel them, I never ask a parent to go for MRI for me. But where I feel that yes, because with this experience of 22 years now, by the grace of Almighty, when a child is coming to me, when I am evaluating a child, and with the hard work which my team does from the back end, analyzing each and everything for me, it becomes easier for me to judge that whether a child is having chances of some intellectual disability or a genetic malfunction or not. So, where I feel that yes, there are some chances, I always guide the parents to go for tests. But where I feel that no, they are not required, there, I always guide the parents that see, it is your hard work together as a family and working as a unit with our team that is going to bring your child out of autism. So, yes, diagnosis is important, categorization is important, reasoning is important, but we should not lose even a single day of our child life before we can start working in the right direction to bring him out of autism. That is the most important thing. So, if your child is not tagged as yet as being autistic, don't wait for him to be tagged. And if your child has already been tagged by autism, ADHD, global developmental delay, there are multiple terms that the physicians they nowadays use for this. But in most of the conditions, I don't see major global developmental delays. I see that yes, the child is under a particular mindset and the child is not using those words. And then when we use certain herbs and when we use certain techniques, the child comes out of this phase of mind. So this is the last question which I'm going to take now, and this is from Desk List. I may have pronounced it wrongly. If a 6-year-old don't speak, Is it too late or speech is still possible? In most of the cases, speech is possible. Speech almost becomes impossible or very tough to possible to develop in a complete way when a child crosses 14 years. After that, we can create words. We can make a child communicate to one words, to two words, but developing complete speech becomes really tough for us. When we talk about a 6 years old child, now that child is at a trainable age yet. When we talk about age below 4.5 years, it is the reflex language development age of the child. Now, below 4.5 years of age, if a child comes to us, our life is easier. That is the easiest case to handle. And in most of the cases, if the parents over there are not pretty reluctant about going for the ABA stuff from their own physicians, if they start with ABA also from us, the speech occurs very quickly. And then after 4.5 years of age, up to around the age of 13, 14 years, the child is at an age where he can be language trained. We need a bit of training, again through ABA, where we need to create certain situations for the child so that the child starts using words. The child starts understanding that yes, if I'll use words, my life will become easier. Now that is something which is very important for the child to be realizing. Madhu Vermaji, I have got certain details in regards of what is being given as a medication for your child, but again I have not got the dosage as yet for the same. I'll try if my team can provide me with the dosage, because then it will be possible for me to check whether it is the right kind of dosage being given or we need to do something about the dosage of the same. And again, I have not got any details in regards of that whether any kind of psychotherapy is being going on over there or not. So in case I get some details further from my team, I will immediately be elaborating you on that. And if you can share the same, I'll be guiding you that. So when so you are Kendrick's dad and you are already with our team. That's really great. And what about ABA? How many sessions of ABA are going on in this case? And when I talk about ABA, who is the one who is doing it for you from our team? When I use the term ABA, it is applied behavior analysis. Now, that is very important to understand. Why this analysis? Because every child is different from every other child. Just like no two adults can think exactly the same. We can't expect any two children to be exactly the same. So, what becomes very important for us to understand over here is that we need to analyze why a child is not speaking, why a child is hyperactive, why a child is not making eye contact, why a child is aggressive, why a child is babbling, why a child is having sensory issues. Now, all those things need to be analyzed. And ABA is a part and a very important part of our treatment. In fact, during my research, now I am currently doing my DLIT and I am already PhD in autism and the role of Ayurvedic herbs in certain psychological disorders. So during my previous research also, and again when I am doing DLIT and in my further research also, I always use herbs with psychotherapy. And when we say herbs with psychotherapy, so on one hand, when we are using certain herbs for the child, on the other hand, we are using certain psychotherapeutic techniques, those techniques which can modify the behavior in the way in which we want to modify. Just think about yourself. For example, on one odd day you are very angry, you have had a rough day at office, you are not very happy about it, and you come to your home and you are not in a good mood, and all of a sudden your father or your one of your friends or your wife, someone who is very close to you, does some extraordinarily good thing for you, speaks to you in a very positive manner. Within the next 15, 20, 30 minutes of that nice talk, you will forget half the agony which happened during the entire day. So it becomes very important. Now, this is a simple example which I just quoted for you. So when we talk about any child who is shouting, who is aggressive, who is not settling down, there are multiple things going on in the mind of the child. We need to read the brain of the child, the mind of the child, to be more precise and more correct technically. And once we analyze why that is happening, half the thing is already done. Because then when we analyze it, we start making plans, we start making strategies. And since we are already using herbs, now those herbs already bring the child to a very positive frame of mind. And when that is supplemented with the techniques which our team guides to the parents, believe me, then the results are pretty quick. Because then a child will start coming out of that phase pretty quickly. And we always keep targets for the child. We never pile up the child with too many targets at every step. Every 6 months, we fix up some targets. The parents should know what are our targets. And then, together as a team, when we are working for those targets, the results are really miraculous to come. The only problem which occurs is in those cases who see our supplements, they order it online. There is no harm in that also. But then they forget that they have to join the lives, they have to join the training sessions. Because for a normal child who is absolutely normal, who's going to school, if a parent is expected to help the child in some homeworks, in certain competitions, in certain performances, an autistic child is even more demanding. So for the initial phase of our treatment at least, we require ample time from the parents to be working in coordination with us. And wherever you as a parent feel that it's getting tough for you, it's not possible for you to be doing it at your own end, we are more than willing and more than welcoming you to our center in India, where you can step in for a few months in a very comfortable space. We are going to do everything for your child, and you will see the results then are coming even far more quicker, at least 4 times more quicker than when you are doing it by yourself. Because when too many trained people are doing the stuff for your child, it becomes easier for the child, and it becomes easy to learn and understand for you as a parent also. So that is all from my end in today's live, and I would really thank you all who joined us for this brief live. And these are the kind of interactive sessions which I always believe on, that we should always be interacting with one another to understand how we need to work in tandem to bring these little gems, these angels, out of this tough phase for them, out of this autism. So believe me, autism is a temporary phase in the life of a child if it is treated timely. Thank you for joining us. Have a good day and have a good evening over here in UK. Bye-bye. Namaskar.
Autism is a temporary phase in the life of a child if treated timely.
Patient name Parth, age 3 years, disease autism. Chief complaints: speech delay, hyperactivity, irritative behavior, less interaction, less understanding. The parents of the child consulted Dr. Navdeep Sharma on April 2023 at 1:09 p.m. and felt the scope of treatment to work for the child. He did not respond clearly and showed irritative behavior most of the times.
करो
आ जाएगा वो।
कलर करो, वेरी गुड पार्थ, कलर करो। नो, इस हैंड से कर, वेरी गुड, इसके अंदर रख दो, वेरी गुड। पापा का हैंड, दीदी का हैंड करो, हैंड चलो, वेरी गुड, खाओ, वेरी गुड। हेलो पेरेंट्स, पार्थ हेलो करो, हेलो करो। ये पार्थ है, मेरा बेटा, 4 साल का होने वाला है। लास्ट ईयर जुलाई में हम डॉक्टर नवदीप शर्मा सर के यहाँ पहुँचे थे। हमें एक सर ने मेरे बताया था सर के बारे में। हमने सोचा भी नहीं था कि आज 9 महीने में पार्थ मम्मा पापा हमसे बोलेगा इतनी जल्दी। हम तो मतलब बड़ा एक माँ पेरेंट्स के लिए एक रहता है कि कब हम मम्मा पापा सुनेंगे पार्थ के मुंह से। आज पार्थ मम्मा पापा और विद सेंस सब कुछ बोलता है। भगवान की कृपा से और सर की मेडिसिन और सर के गाइडेंस से आज 9 महीने में पार्थ एक नियर टू नॉर्मल लाइफ जी रहा है। और स्कूल में भी पार्थ प्ले ग्रुप में था। अभी जस्ट 15 दिन पहले ही स्कूल में मैम ने बोला कि पार्थ को हम नर्सरी में भेजेंगे। और जो सर ने जो लाइफ में हमारी खुशियाँ दी हैं, बहुत एक पेरेंट्स के लिए इससे ज़्यादा और क्या हो सकता है कि उसका बच्चा इतनी जल्दी और इतना अच्छा इम्प्रूवमेंट हो जाए। एक पेरेंट्स के लिए बहुत बड़ी बात है। थैंक यू सर, थैंक यू वेरी मच हमारी लाइफ में इतनी बड़ी खुशियाँ देने के लिए। थैंक यू एंडी निरोगम।
Autism is a temporary phase in the life of a child if treated timely.
Patient name Vivan, age 4.5 years old, disease autism. Chief complaints: speech delay, less understanding ability, inexpressive, sensory issues, lack of focus. The parents of the child consulted Dr. Navdeep Sharma on 27th November 2022 at 11 o'clock am and felt the scope of treatment to work for the child. The chief complaints were speech delay, unable to write and sensory issues. The child could not write by himself. He was also not very socially active. Throughout the treatment, significant improvement was seen in the child. He started writing on his own, gave answers and also became active. He started interacting more and gave answers instantly. His focus also saw an improvement. He also participated voluntarily in activities and also excelled academically. Instant responses were also seen within a few months of treatment. With improved attention span, he became quick in recognizing and mind games as well. He was able to interact more with peers, participate in class and also understand things in a better way.
हाय, मेरा नाम प्रिया है एंड मेरा बेटा है 5 साल का होने वाला है एंड मुझे नवदीप सर से मेडिसिन लेते हुए मोर देन 1 ईयर हो गया है एंड आई हैव चेंज लाइक आई हैव सीन इमेंस चेंज इन माय सन। लाइक जब हम यहाँ पे आए थे तो ही वॉज लाइक वो एक एक वर्ड ही बोलता था एंड जब से हमने मेडिसिन शुरू की है एंड मेडिसिन के साथ साथ शिरोधारा भी इसकी मोर देन 1 ईयर से चल रही है एंड विद कंटिन्यूटी ऑफ दिस मेडिसिन एंड ऑल उसमें ड्रास्टिक चेंज है। जैसे अभी वो सब कुछ अपनी चीज़ें 99% अपनी चीज़ें वो बता पाता है ईजिली एंड दैट टू ही स्टार्टेड मेकिंग फुल सेंटेंसेज ऑल्सो। क्लास में भी अकेडमिकली ही इज़ गोइंग सुपरबली ऑसम। ही हैज स्कोर्ड 88% इन हिज लास्ट टर्म एंड जहाँ पे जब वो नर्सरी में था ही जस्ट स्कोर्ड 55%, नॉट इवन 50%। एंड अभी जस्ट टर्म ए में ही इज़ इन जूनियर केजी, अभी टर्म ए में उसके 88% नंबर आए हैं। नाउ ही हैज स्टार्टेड राइटिंग ऑल्सो। पहले वो मतलब पकड़ के लिखता था, पेंसिल पकड़ के, उसका ग्रिप भी प्रॉपर नहीं था बट अब वो लिखने भी लग गया है। प्लस मुझे जो मेडिसिन से जो मुझे मेन फ़र्क दिखा है दैट इज़ सेंस, जो मुझे चाहिए था कि सेंस में थोड़ी सी डेवलपमेंट। पहले उसको फ़र्क ही नहीं पड़ता था कि कोई घर में आ रहा है जा रहा है, वो जस्ट कमांड वाइज ही चल रहा था। लाइक ही स्टार्टेड फॉलोइंग माई कमांड्स, लेकिन अपने दिमाग से वो कुछ नहीं कर रहा था। बट जब से मेडिसिन लेना शुरू किया आफ्टर 3 मंथ्स मुझे ज़्यादा चेंजेस दिखे हैं। 3 मंथ्स में धीरे धीरे चेंज आए। अब विद इन अ ईयर तो ड्रास्टिक चेंज है। जैसे उसको देख के आप बोल ही नहीं सकते हो कि दैट ही हैड माइल्ड ऑटिज्म, तो उसको माइल्ड ऑटिज्म ही था बट अब वो माइल्ड ऑटिज्म के स्पेक्ट्रम से भी निकल गए। अब जस्ट उसके थोड़े थोड़े सिम्टम्स रह गए हैं एंड वी आर स्टिल इन टच विद नवदीप सर। वी आर स्टिल टेकिंग द मेडिसिन। उनकी जो भी गाइडलाइंस है, बीट डाइट, बीट उनका यंत्र, वी आर डूइंग दैट रिलीजियसली एंड आई मीन इट। विद दैट हम उनको हीलिंग म्यूजिक भी सिखाते हैं जिससे बच्चा इंटरनली भी हील होता है। मेडिसिन हम दे रहे हैं। सो आई एम क्वाइट हैप्पी विद दी मेडिसिन एंड फैसिलिटीज। द डॉक्टर्स आर एवरी टाइम अवेलेबल और मुझे हफ्ते में 1 साल से ज़्यादा हो गया, मुझे हफ्ते में 1 कॉल ज़रूर आता है यहाँ से दैट यू नो वेदर द थिंग्स आर गोइंग राइट। विवान के बारे में दे आस्क कि वो कैसा चल रहा है। तो लाइक दे आर इन टच, द होल टीम इज इन टच विद मी मोर देन 1 ईयर। मेडिसिन यहाँ पे टाइम से आ रही है, हमें घर पे डिलीवरी मिल जाती है। जब हमें आना होता है नवदीप सर के हमें कॉल्स आ जाते हैं दैट यू नो वो अवेलेबल है इफ़ यू वांट टू मीट। तो द एज अ क्रक्स आई एम सेटिस्फाइड विद द मेडिसिन ऑल्सो एंड विद द स्टाफ ऑल्सो। थैंक यू।
Autism is a temporary